Well, the battle over health care is heating up on Capitol Hill today. The House Rules Committee meeting this morning on a bill to repeal the health care law. And tomorrow, the Oversight Committee in the House is set to examine the law's impact on doctors, patients, and job creation. Meantime, House Democrats are launching a full-scale ad war targeting those Republicans who want to repeal the law. Here's a sample.
Carla knows the breast cancer screening she got saved her life. Carla doesn't know that her congresswoman may vote to repeal the law that added preventive coverage to Medicare. But she might. Your member of Congress may vote to repeal important health care benefits for everyday Americans.
Well, Congressman Darrell Issa is the chairman of the House Oversight and Government Reform Committee that will hold this hearing tomorrow. Mr. Chairman, welcome back to the program. One of the focuses that you will have tomorrow, and I guess you're not that concerned about these Democratic ads, you believe that the public is with you on this, is small businesses. I mention this because the president an hour and a half ago talked about how he wants to cut taxes for small businesses, and he believes this tax hike he's proposing will not affect 97% of them. You believe that the health care law will affect small businesses negatively. Exactly how?
Well, first of all, the complexity that Obamacare brings is amazing. I'll give you just one simple example. If a company of 50 employees goes to 49 and stays at 49 full-time employees, they get out from underneath Obamacare. A lot of companies are going to make those decisions by simply moving a few people to part-time instead of full-time. The last thing we need in America is more part-time jobs. We need full-time jobs whenever possible. But secondly, let's just take an example. If you're trying to calculate how you offer health care and you offer it, but some of your employees go to the exchange because it's a better deal, which Obamacare anticipates, well, what happens is those people actually cause the employer who's already giving health care to get a separate additional $1,000 bill. And the list of those kinds of complexity goes on and on and on. Remember, this is health care that is mandated by all kinds of nuances rather than health care being provided by employers. Last point, and this is the big one, is the penalty, the $2,000 penalty for an employee who doesn't have health care and the $2,000 for the employer who doesn't offer it. None of that goes to health care. You literally have a situation in which if the employer and employee said, I'll put $4,000 into buying something, they can't do it because that's not enough to buy a $12,000 family bronze product.
So let me just jump in. So if you got a family of four earning $50,000 a year, and they say, I'll look at the bronze plan. That's the cheapest plan under the Fed's plan, the state exchange. But it's going to cost me $5 grand out of pocket, so I'm not going to do it. I can't afford it. I'm not going to pay that $5 grand. They're going to get penalized. They're going to have to pay the IRS $2,000 as a penalty.
Exactly. The employer and employee both would be paying $2,000 each. In other words, the government would collect, and this is scored in Obamacare, would collect $4,000 in penalties basically because they can't afford the bronze plan, this plan that has some of those things like the Democratic ad that you just played. Instead of saying, let's try to have plans that at least do the minimum, what they've done is they've made the minimum $12,000 for a family of four. That's not affordable in some cases, so it's going to force $4,000 in fines between the employer and employee.
And then you don't get anything when you get fined. It's not like they give you the health insurance. You have to pay the fine. You don't get anything.